Assalamualaikum. Today we will be discussing two powerful classes of antibiotic, the third and fourth generation of cephalosporin. These drugs are essential in treating severe bacterial infections, especially in cases where resistance to other antibiotics occur. Understanding this drug helps us provide better patient care and tackle growing antibiotic resistance. As you can see on the left, the third generation of cephalosporin focuses on gram-negative infection. Meanwhile, on the right, fourth generation adds enhanced resistance and broader spectrum. Okay, let's start with the third generation. These antibiotics like ceftriaxone, ceftazidime, and cefizime are known for their extended coverage against gram-negative bacteria. One of their standout features is their ability to penetrate the blood-brain barrier, which makes them highly effective in treating infections like meningitis. For instance, ceftriaxone is frequently used for meningitis caused by H. influenza and Neisseria meningitis. It's also prescribed for typhoid fever, gonorrhea, and as part of surgical prophylaxis. Additionally, ceftazidime, another drug in this class, offers excellent coverage against Pseudomonas aeruginosa, a challenging and resistant organism. In summary, third-generation cephalosporin are versatile and widely used for severe bacterial infection requiring extensive gram-negative coverage. Now moving on to the fourth generation. The key drug here is cefepime, which is even more advanced. It provides broad-spectrum coverage, meaning it's effective against both gram-positive and gram-negative bacteria, including resistant organisms. Cefepime is commonly used to severe infection in immunocompromised patients, such as febrile neutropenia. It's also effective against ampicillin C beta-lactamase-producing bacteria, which are resistant to earlier cephalosporins. This enhanced activity makes cefepime a valuable option for critically ill patients. In short, fourth-generation cephalosporin like cefepime are reserved for more complex and resistant infection, offering an important tool in modern medicine. Here a quick comparison why both generations are effective. Third generation cephalosporin focus more on gram-negative coverage, and fourth generation adds enhanced resistance to ampicillin C beta-lactamases. However, they do have effect we need to monitor. First, ceftriaxone can cause a gallbladder issue or biliary sludge. For cefepime, may cause neurotoxicities such as confusion or seizures, especially in patients with kidney problems. This highlights the importance of careful patient monitoring and dose adjustment. To wrap up, both third and fourth generations of cephalosporin are crucial antibiotics, each with unique strengths. Ceftriaxone is versatile for treating infections like meningitis and typhoid fever, while cefepime is reserved for severe resistant infection. Healthcare provider understanding these drugs help us provide safer, more effective care for our patients. Here you can see ceftriaxone and its wide range of uses from meningitis to typhoid fever. Ceftazidime shown here is particularly effective against Pseudomonas aeruginosa. This is cefepime, an example of a fourth generation of cephalosporin that is highly effective in critical cases. Both ceftriaxone and cefepime have some side effects to monitor. For example, ceftriaxone may cause biliary sludge, and for cefepime, on the other hand, it requires careful monitoring for neurotoxicity.
Today I will be presenting about pharmacodynamic and pharmacokinetic for the ceftriaxone, third generation cephalosporin, and cefepime, fourth generation cephalosporin. Let's begin with ceftriaxone. Ceftriaxone is a beta-lactam antibiotic widely used for bacterial infection. It works by binding to penicillin binding protein or PBBs. These proteins are essential for bacterial cell wall synthesis and division. By inhibiting PBBs, ceftriaxone prevents the cross-link of peptidoglycan strand, which weaken the bacterial cell wall and cause osmotic instability and ultimately leading to bacterial cell death. However, resistance to ceftriaxone can occur. This may be due to beta-lactamase production, change in PBBs, and reduced bacterial cell permeability. A key point to note is that ceftriaxone should not be mixed or given with calcium-containing diluent in the same IV line, as this can lead to precipitate formation. Additionally, it may cause biliary sludge or gallbladder pseudolithiasis, and its overuse is associated with the development of multi-drug resistant organism. Next, let's discuss cefepime, a fourth generation cephalosporin. Like ceftriaxone, cefepime is a beta-lactam antibiotic. However, it is active against gram gram-positive and gram-negative bacteria. Cephalosporin works by binding to PPBs, disrupting bacterial cell wall synthesis during the final stage of peptidoglycan layer formation. One of cephalosporin's significant advantages is its enhanced stability against beta-lactamase enzyme, including some chromosomal beta-lactamases found in gram-negative organisms. It is a bactericidal antibiotic that works in time-dependent manners, meaning its efficacy depends on prolonged exposure above the minimum inhibitory concentration. Resistance to cephalosporin can arise from extended spectrum beta-lactamase production or efflux pump. Like ceftriaxone, overuse of cephalosporin in a hospital setting can contribute to multi-drug resistant gram-negative bacteria. Now, let's move on to the ceftriaxone pharmacokinetic. This medication is administered parenterally either intravenously or intramuscularly, since it has less than 1% bioavailability when taken orally. It has a wide distribution range from 5.78 to 13.5 liters in healthy patients and up to 35.2 liters in those with sepsis. Ceftriaxone is particularly effective in treating bacterial meningitis because of its high penetration into cerebrospinal fluid. Its metabolism is negligible, which most of the drug excreted unchanged via the kidney and bile. The drug has a relatively long half-life of 5.8 to 8.7 hours, allowing for convenient dosing once or twice daily. Now, let's review on the cephalosporin's pharmacokinetic. This drug is also administered parenterally via IV or IM routes. Its rapid onset of action is due to direct delivery into the systemic circulation. Cephalosporin is well distributed into tissue and body fluid but has a limited penetration into the cerebrospinal fluid compared to ceftriaxone. Cephalosporin undergoes minimal hepatic metabolism with less than 1% metabolized in the liver. It forms a stable compound known as NMP and oxide through rapid oxidation of NMP. Most of the drug, approximately 85%, is excreted unchanged in the urine via glomerular filtration and tubular secretion. Because of this, renal function must be closely monitored and dose adjustments are necessary in patients with renal impairment. Cephalosporin has a moderate half-life of 2 hours, requiring 2 to 3 doses per day to maintain therapeutic levels. Unlike ceftriaxone, cephalosporin has a lower risk of precipitate formation.
Today, I will explain about drug class, dosage, and therapeutic use. Ceftriaxone is a third-generation cephalosporin antibiotic. It belongs to the beta-lactam antibiotic group and works by stopping bacteria from building their cell wall, causing them to break down and die. Next, this antibiotic has a broad-spectrum effect, meaning it works against both gram-positive and gram-negative bacteria. It is also resistant to many enzymes called beta-lactamase that some bacteria produce to resist antibiotic. For administration method, ceftriaxone can be given either as an intravenous injection or intramuscular injection. The routes and dosage depend on the type and severity of the infection. For adults, the usual dose is 1 to 2 grams given once or twice daily. It adjusted based on the infection being treated. While for children, the dosage is calculated based on body weight. The typical dose is 50 to 100 mg per kilogram of body weight per day. It's divided into dose given every 12 to 24 hours. Next, let's take a look at the fourth generation of cephalosporin, which is cefamine. Cefepime is a fourth-generation cephalosporin antibiotic. It belongs to the beta-lactam antibiotic group and works by stopping bacteria from building their protective cell wall, which lead to bacteria dying. This medicine is a broad spectrum, meaning it works against a wide range of bacteria, including both gram-positive and gram-negative types. It is also effective against Pseudomonas aeruginosa, which is bacteria that is often hard to treat. Moreover, cefepime demonstrates greater resistance to beta-lactamase compared to early generation cephalosporin, making it an excellent choice for treating multi-drug resistant infection. For administration method, cefepime can be given through an intravenously injection or intramuscularly injection. For adults, the typical dose is 1 to 2 grams given every 8 to 12 hours. The exact dose depends on how serious the infection is and the patient's kidney functions. While for children, the dose is based on their weight. Usually it is 100 to 150 mg per kilogram of body weight per day. It is divided into dose given every 8 to 12 hours. For the therapeutic use, third and fourth generation cephalosporin are powerful antibiotics used to treat serious bacterial infection. They work by killing bacteria and stopping their growth. Third-generation cephalosporin are commonly used to treat severe infection, such as pneumonia, which is infection in the lungs, sepsis, and meningitis. Other than that, sexually transmitted infection, for example, gonorrhea, intra-abdominal infection such as peritonitis, and skin and soft tissue infection. Meanwhile, fourth-generation cephalosporin are used for severe and hospital-related infection, such as pneumonia, including nosocomial pneumonia, febrile neutropenia, urinary tract infection, skin and soft tissue infection, and intra-abdominal infection, which is used when the infection is severe. For apical therapy, fourth-generation cephalosporin are often chosen in the hospital as a first-line treatment for severe infection, when the exact bacteria causing the infection are not yet known. Their broad-spectrum coverage made them a reliable choice.
Side effects of third and fourth generation cephalosporin include a range of issues. For third generation cephalosporin, common side effects are biliary sludging, which can lead to gallbladder problems, neurological effects such as seizure in case of overdose or renal failure, and the risk of calcium precipitation when combined with calcium-containing solutions. Fourth generation cephalosporin are associated with neurotoxicity, which may present as encephalopathy, confusion, agitation, or seizure, particularly in elderly patients or those with renal impairment, as well as fever as a known side effect. Both generations share similar side effects, including pain or swelling at the injection site, elevated liver enzyme, transition kidney dysfunction, and hematologic issues such as eosinophilia, leukopenia, thrombocytopenia, and rarely coagulopathy. The adverse effects of cephalosporin vary across different generations but share some commonalities. For both generations, renal toxicity can exacerbate renal impairment, especially when combined with nephrotoxic agent, while hematologic effects such as hemolytic anemia, hypersensitivity reactions such as rash, pruritus, fever, or anaphylaxis, and superinfection like candida overgrowth due to a broad spectrum activity may occur. Third generation cephalosporin can cause a bleeding tendency due to vitamin K disruption, cholesterol iodase, difficult associated diarrhea (CDAD) from prolonged therapy, and drug interaction such as ceftriaxone precipitating with calcium-containing medication. Fourth generation cephalosporin are more likely to cause neurotoxicity, including confusion, encephalopathy, or seizure, particularly in patients with renal impairment, and their overuse can increase the risk of developing multi-drug resistant organisms. The contraindication of cephalosporin include hypersensitivity, as patients with a known allergy to cephalosporin or a history of severe allergic reaction to penicillin or other beta-lactam antibiotics should avoid their use due to potential cross-activity. High dose of cephalosporin, especially in patients with renal impairment, may increase the risk of seizure, making dose adjustment crucial to prevent toxicity. Cephalosporin, primarily excreted by the kidneys, require careful use in patients with renal dysfunction. Caution is advised in neonates due to the risk of biliary sludging or kernicterus. During pregnancy and breastfeeding, cephalosporin are generally considered safe but should only be used when clearly needed under healthcare guidance. Variation in spectrum of activity exists, with cephalosporin showing broader activity and better resistance to beta-lactamase enzyme.
Today, I will be discussing the administration of two widely used cephalosporin antibiotics, which are ceftriaxone and cefepime. This presentation will cover pre-administration consideration, administration technique, monitoring during therapy, and post-administration care. So, before administration ceftriaxone or cefepime, several important factors must be evaluated. So the first one is allergy screening. It's crucial to check for any allergies to cephalosporin, penicillin, or beta-lactams to prevent hypersensitivity reaction. So the second one is medical history. So the healthcare provider should assess the patient renal and hepatic function, as impaired organ may require dosage adjustment. Next, we have to review potential drug interaction, particularly with nephrotoxic medication or anticoagulants. So the third one is laboratory tests. which is conduct baseline tests such as renal and liver function panel to detect any pre-existing dysfunction. So the fourth, patient education. We have to educate the patient about the medication, possible side effect, and the importance of completing the full course of antibiotic to avoid resistance. Now, let's move on to administration technique. So the first one is route of administration. Cephalosporin is administered intravenously or intramuscularly with once daily dosing due to its long half-life. Cephalosporin is also given intravenously or intramuscularly but require dosing every 8 to 12 hours depending on the severity of the infection. For reconstitution, use water to compatible solution. For intramuscular injection, lidocaine may be added to reduce pain, but this should be avoided in patients with lidocaine allergies. So the technique for intravenous administration, infuse the medication over 30 minutes to minimize the risk of thrombophlebitis. For intramuscular injection, use large muscle like the gluteus or thigh and rotate injection site to avoid localized irritation. Last but not least, dosage adjustment. Adjust dose in patient with renal or hepatic impairment. Avoid using cephalosporin in hyperbilirubinemic units due to risk of bilirubin displacement. In therapy, monitoring is essential. We have to look at the effectiveness by observing the resolution of symptoms such as fever, pain, or inflammatory marker like white blood cell count. So the second one is adverse effect. Some side effects include diarrhea, nausea, and rash. While serious effects may include hypersensitivity reaction, C deficit associated diarrhea, and severe pain-induced neurotoxicity, especially in patients with renal impairment. Regular assessment of renal function are critical to avoid drug accumulation and toxicity, especially for cephalosporin. Last, drug interaction. Monitoring for interaction with anticoagulant, which may increase bleeding risk, and nephrotoxic drug, which could exacerbate renal impairment. After administering the medication, the following steps ensure effective therapy and patient safety. So the first one is patient education, which is reinforce the importance of completing the entire antibiotic course even if symptoms improve early, and also advise the patient to report any unusual side effects such as severe diarrhea or neurological symptoms. So next, outcome evaluation, which is assess whether symptoms have resolved and lab markers have normalized. We evaluate the treatment plan if the infection persists or worsen. Third, super infection prevention. Educate the patient on proper hygiene and signs of super infection such as new fever or oral thrush. Last but not least, documentation. Record essential details such as dose, route, time of administration, patient response, and any adverse effect observed during therapy.
We'll be discussing important health teachings related to the use of antibiotics ceftriaxone and cephalosporin. This guideline will help ensure safe and effective use for this medication while minimizing any potential risks. Let's begin by understanding the general instruction. For general, first let's talk about the purpose of this antibiotic. Ceftriaxone and cephalosporin are used to treat bacterial infection, but they won't work for viral infection like colds or the flu. Next, adherence to treatment is critical. Even if you start feeling better, do not stop taking your antibiotic early. Stopping midway can lead to incomplete treatment or even antibiotic resistance, making future infections harder to treat. Now, regarding administration, these medications are usually given by injection or IV. Always follow your healthcare provider's instruction carefully. Lastly, let your doctor know if you have a history of allergies, especially to cephalosporins or penicillins. If you experience symptoms like a rash, swelling, or difficulty breathing, seek immediate help. It could be a severe allergic reaction. Okay, second, for common side effects, like any medication, ceftriaxone and cephalosporin can have side effects. So for ceftriaxone, mild effects including diarrhea, nausea, or a headache. Rare but serious side effects such as a severe diarrhea caused by a condition called Clostridium difficile, gallbladder problems, or allergic reaction need immediate attention. Okay, so for cephalosporin, mild side effects include rashes, itching, or injection site pain. Rare but serious issue like neurotoxicity, which can cause confusion, seizure, or alter mentis, are more likely if someone has kidney problem. If you notice any severe or persistent symptom, report them to your doctor right away. And then for dietary guidelines, now let's discuss the dietary consideration to support recovery by taking this antibiotic. First, hydration is a key. Drink plenty of water, flush out the medication, and prevent dehydration, especially if diarrhea occurs. Second, consider probiotic like yogurt or kefir to maintain gut health and reduce the risk of diarrhea caused by antibiotic. Third, avoid alcohol. Yes, alcohol can increase the risk of side effects like nausea or dizziness, while ceftriaxone or cefepime. Lastly, eat a balanced diet with fruits, vegetables, lean proteins, and whole grains. This helps boost your immunity and support your recovery. Before I finish, here are a few extra precautions. First, inform your doctors if you have kidney or liver issues, as dosage adjustment may be necessary. Second, if you experience severe diarrhea, do not self-medicate with anti-diarrhea drugs. Consult your healthcare provider immediately. Last one is for pregnant or breastfeeding women, it's essential to discuss the use of this antibiotic with your doctor.
Conclusion: ceftriaxone has a broad spectrum of activity against gram-negative and some gram-positive bacteria, making it ideal for community-acquired infections like pneumonia, meningitis, and gonorrhea. Its long half-life allows convenient once-daily dosing, and it penetrates the blood-brain barrier effectively for treating central nervous system infection. However, it is less effective against resistant organisms, including Pseudomonas aeruginosa. Cefepime, on the other hand, has a broader spectrum and excels against resistant gram-negative bacteria, including Pseudomonas aeruginosa. It is more stable against beta-lactamase enzyme and is commonly used in hospital-acquired infection, such as ventilator-associated pneumonia and febrile neutropenia. Like ceftriaxone, cefepime also crosses the blood-brain barrier and can treat meningitis. In summary, ceftriaxone is favored for community-acquired infection due to its convenience and effectiveness, while cefepime is reserved for severe hospital-acquired or multi-drug-resistant infection. Together, they play crucial roles in managing a wide range of bacterial infections.